Welcome everyone to our Child Life webinar. We are so excited to have the amazing Victoria today lead an amazing webinar on pain management. So I'm not going to take the spotlight, Victoria. I'm going to hand it over to you.
Thank you for having me. I'm super excited to get to give this presentation. It's one of my favorites, so thank you. All right, so as Sunny mentioned, my name is Victoria, and today I'm going to be talking about reducing procedural pain, why pain management is important in pediatric patients. So before I get started, I'd like to just share a little bit about me, my child life journey, how I got to be so passionate about pain management. I've been a child life specialist for 6 years now. I started my career in the South Side of Chicago at La Vita Children's Hospital. In that role, besides providing child life services to our medically complex populations, I also was the chair of our pain management committee. Our medical director resigned and I was then the chair of the committee, and that has really sparked my interest in pain management and made me, stay up to date on all the latest research and the importance of pain management. That role actually led me to my next role, which was a role with the Chicago Department of Public Health. It was a role that I advocated for a very long time. We as child life specialists are very big advocates. This took a lot of, pushing from my end. I volunteered with the Department of Public Health at their pediatric COVID vaccine clinics for about 3 months before I finally said, I can't volunteer anymore. Can I please get a job? And they hired me on full time. That was a contract position. So when the contract ended, I started my current role, which is with Starlight Children's Foundation as a mission delivery coordinator. So in my role, I help make sure hospitals have the programming that they need, the tools that they need. I help manage our hospital events and do a lot of our storytelling. And the last thing of that, so I also do pain management, just teaching resources, things like that. In my role with the Chicago Department of Public Health, I also did kind of like a training like this, but then I would certify the facility that, they completed this training about pain management, and they take pain management very seriously. All right, and then to actually start the presentation. So as many of you know, children experience pain uniquely. What one child finds very painful, another child can say, it's not that bad. Immature coping mechanisms and developing neurological systems can lead to physiological and psychological differences. And then the pain and the distress around pain leads to lifelong impacts, as many of us know, similar to trauma. So it's not just, that child had a terrible procedure, they're never going to think about it again. We want to remember that those experiences can, lead to later implications, and that is very important. Up to 1 in 3 children, youth live with chronic pain. That was a study done in 2011. And there's a lot of impacts for undermanagement of pain. There's, just the impairment of a child's functioning, their school, just their life. Untreated pain can lead to delay in healing. It can literally alter brain development. So if you have a lifelong pain sensitivity, there's a likelihood that, in childhood, you also had bad pain experiences. And there's a good chance that when you don't have pain management, it can lead to chronic pain and increased risk of opioid addiction later in life. But not only that, there's also developmental considerations, physiological responses, psychological impact. There's a new study that came out that says unmanaged pain in children can lead to physiological changes like increased heart rate, blood pressure, and stress. These responses adversely affect the healing process and recovery, and that can lead to longer hospital stays, increased healthcare costs, and a higher risk of complications. And when you think about that, us as child life specialists, we want to say, we are necessary, we are needed. We can decrease the time in the, before a child goes to the operating room, we can decrease time that they're spending, decrease funds. So these are the kind of things that you want to keep in mind when you're advocating for yourself, for your role. Impact of pain. So for individuals and for healthcare providers. So for individuals, there's just dissatisfaction with care, increased likelihood of developing a needle fear. There's just unnecessary suffering. The child doesn't have to go through that. They can have pain management. They can have resources given to them to avoid that. Future non-compliance behaviors. A child, who has these bad experiences is more likely to be non-compliant going forward. And then just suboptimal health outcomes. For healthcare providers, they have inadequate quality of care. They also have an increased likelihood for providers to have dissatisfaction with their job. So if you're a healthcare provider, a nurse, a doctor that's providing procedures constantly, and your patients are screaming in pain, it's not joyful for them. They have that increased likelihood that they're going to be dissatisfied. Also, non-compliance behaviors for providers, they're not following protocols, and then suboptimal health outcomes. Okay, so the question is, can everyone think about a time from childhood where you experienced medically related pain? Do any of you vividly remember that experience? Like, if you think about it, you can remember what happened, why you felt that way. Still scared of the dentist. When I broke my arm at the age of 6 years old, I fell off the monkey bars. Oh, yes, I can imagine how those experiences would definitely stay with you. The one that I always give is that when I was 5 years old, I was racing my sibling up the steps, and we had wood steps at the time. He pushed me and I fell, and I split my chin completely open. And to this day, I still remember the look on my mom's face, the ambulance ride, the lights in the emergency room. I was so traumatized, and that it's like it happened yesterday, how vividly I can imagine everything. It wasn't too bad for me, but then I got stung by a bee. Oh, see, yes, all those little things, they all, in that moment, sometimes it doesn't feel that bad, but then in the future, you're like, wow, that was awful. When I got morphine injection in my leg after I broke my tibia, I was 5 years old, and I remember how scared I was. Exactly. Those experiences of traumatic pain, as a child, you still think about them, but then as an adult, when you're really like either very fearful of the doctor, of going to the hospital, or you experience pain again, it's almost like trauma. It's like PTSD, essentially. Those experiences do stick with you, and they do stick with our patients. So it's so important as child life students going into the field, child life specialists, that we always keep that top of our mind, that we want to give children good pain experiences, because it leads to such big implications later in life.
All the lands were fraught with persistent pain. So widespread was this affliction that 1 in 4 people experienced it. The pain lasted for more than 3 months. It shadowed their daily lives, held them back from everyday activities, and the interventions they tried proved useless. Hey, pain, go away, we've tried it all, but still you stay. Moving less, taking pills, knives and needles, and still we're sore. We can't take no more, no more. But the pain remains like a loyal companion. The people's hopes faded, and they became resigned to living with the pain. Only now the pain was a beast. Then along came a group of researchers, of which I am one. Back off, big fella. I'm Professor Lorimer Mosley, and I'm a pain scientist. Pain scientists are starting to think differently about pain and its causes, and we're making exciting discoveries, like how the way you think about your pain can change the way it feels. Over the next few minutes, I'll help you to understand your pain. Understanding is important because it can change how much things hurt and how much your body can do, and it can help you to tame the beast. First, trust me about this. Pain is not an accurate measure of tissue health. Pain is a protector. By making unpleasant feelings, your brain changes your behaviour so you can avoid injury or your tissues can heal. Sometimes pain is not helpful, like phantom limb pain. You don't expect a missing limb to ache, but it does, and the pain is very real. So how do we explain this? Well, pain is a warning signal from your brain that depends on credible evidence to say your body needs protecting. Sometimes pain's too protective and you get unnecessary warning signals. Pain scientists now understand that there are many ways our nervous system ends up producing unnecessary warning signals. Take conditioning, for example. You think of Pavlov's dog. Every time food was offered, Pavlov rang a bell. Of course, the dog would salivate seeing the food. This went on for a while. Eventually, the dog was conditioned to salivate for the bell alone. Well, conditioning is just one of the ways your body learns pain. And the longer your nervous system produces pain, the better it gets at producing it. Your body learns pain. So what feeds this beast? Well, let's look at how pain works. In your body's tissues, there are specific neurons which normally only respond to harmful stimuli, whether mechanical, chemical or thermal. When they are activated, they send a warning signal to your spinal cord, which can in turn send a signal to your brain. This activity in neurons is called nociception, and it's happening all the time, but only sometimes results in pain. Most of the time, the brain protects you with other things, like movement. Once the warning signal reaches the brain makes sense of it based on the information arriving and a vast amount of information already stored. If there's good reason to think protection is required, then your brain makes pain. One of our amazing discoveries is that you can have pain without any physical stimuli. Thoughts and places might activate the warning signals, and the pain feels exactly the same. But it's not just your brain. Your spinal cord also learns how to generate unnecessary warning signals. So how do you know when your nervous system is learning pain? You may notice your pain spreads or comes on without warning. Your body feels odd and it's hard to move properly. Your pain changes quickly with your mood, and small annoyances can set it off. Old injuries start to hurt again. You're more sensitive to stimuli, and the longer the pain goes on, the more all of this occurs. The old way we understood pain could not explain these things and left many sufferers feeling like no one believed it was real, or for it to hurt so badly there must be a major tissue problem. But we now know how persistent pain happens. So how can you tame the beast? Pain is a very personal thing. There's no one-size-fits-all solution. And while you probably have well thought out coping strategies, it's time to take a new approach to dealing with and reducing your pain, one that focuses on retraining your pain system. This might mean testing yourself physically and moving more than you normally would. Being honest about your current attitudes and beliefs can also help, as can asking your health professional new questions.
How do I know if my pain system is being overprotective?
I'm going to stop it there. But that is one of my, favorite videos to share with others about, the importance of pain and how we think about pain as clinicians. Professor Lorimer Moseley is who came up with that video. He's, great, does a lot of work with pain. And there's also a pain psychologist by the name of Rachel Zoffness. She is actually out of California. I can't remember if it's San Francisco, but she does a lot of work for pain management as well. She says that a child, when they experience pain, it's their danger detector. And I really like that. I like for people to, imagine that. If a child is experiencing pain or they see a needle, it's their brain is saying, alert, alert, danger, there's going to be something wrong. So that's just a really unique way to think about it. But we want to remember that everyone's view of pain is different and everyone will respond in their own way. And some may even show regression. So, something we look out for, especially as child life specialists, is, a child who came in typically developing and now is rocking back and forth, sucking their thumb as a coping mechanism. Each individual's learned the application of the word pain through experiences early in life, and early pain experiences influence later responses. We know that pain during childhood, if it's left untreated, can actually lead to long-term issues that persist into adulthood. Inadequately managed pain alters pain perceptions of the pathways. That's important because that can cause increased sensitivity to pain or chronic pain conditions in the future. So proper pain management in pediatric patients helps really mitigate those risks and prevent the development of those pain syndromes later in life.
Que Pedro corajoso, tia Nete, olha só.
Olha aqui, ó. Pedro. O papai aqui, ó.
E aí, Pedrinho, já foi, Pedrinho, já foi. Acabou, Pedro. Pedro nem chora porque ele é forte.
Calma, Pedrinho.
Que Pedro mais corajoso. Mexe não, Pedro, mexe não. Pronto.
Can someone in the chat tell me, what did you think of that video? How does it make you feel? What can we learn? Good or bad things?
I mean, I can share, as a mom seeing that, it's like, oh no, this little poor baby is crying. Seems like he's so afraid.
Right. Exactly. I mean, in the video, they do a comfort hold. Dad's holding him. It looks like, breaks my heart to see that dad, yep, although he clearly empathized with the son and he was appropriately trying to provide support. Yep. As a CCLS, it's important to also pay attention to how a child's pain impacts the parent. Yes, thank you, Leslie. That's why I play this video. I worked outpatient for a little while, and I have had so many experiences where, the child's like, yeah, I'm going to be fine. It's going to be great. And then it's the parent who's screaming and crying and, having such a hard time. And that in turn, makes it hard for the child. If the child was going to cope well, and now he's looking at mom or dad, and mom or dad is scared and freaking out and crying, it's not likely that the child's also going to be calm. So an important thing to assess is how a parent wants to be involved in a child's procedure. I usually say, hey mom, hey dad, would you be okay to provide support to your child? Would you like to hold your child through, their blood draw, their IV start? If not, we have child life staff who are more than happy to help hold your child. Something along those lines, because if, I've had parents that say, oh no, I can't be in there, I'll pass out. And it's important to respect those boundaries. So that's one reason why I play this video, is to always remember that a parent is also affected by their child's pain. So you always want to consider that with how you're thinking about their involvement. The nurses do a good job of saying, go Pedro, positive reinforcement is important. But the main thing I want us to take away is that parents also are affected by a child's health. So pain is not just experienced by a child. Up to 25% of adults actually have a fear of needles, and most of those fears developed in childhood. Untreated pain can have long-term consequences, as we know: pre-procedural anxiety, needle fears, and then the worst of all, avoidance of healthcare. Adults who are so fearful of pain, of needles, of things like that, they're way more likely to avoid healthcare altogether, which is something we absolutely don't want. All right, again in the chat. So sometimes there are things that can deter a healthcare provider from using a pain management technique. What do you think some of those barriers are? So in the healthcare setting, why do clinical staff members not think about pain management all the time? Why do we not use pain management techniques? Schedule, timing, in a rush, burnout, yep. They'll be fine, costly, huge perspective, yep, exactly. So just the culture of the hospital. Some hospitals have a very heavy pain management is very important. It is our top of mind. This is all we're going to focus on. And then some hospitals just, I'll be fine. And then, like we said, time is a big constraint. This needs to be done now and right now. I have, I'm charting, I have a clock, it has to be done. Available resources. Some facilities simply do not have the resources that others have, the luxury of pain management tools. And then just MIDS. MIDS are things like, and I've heard this before actually, I've heard babies don't experience pain, they would never remember it. Absolutely not. And that is 100% not true. It's actually the complete opposite. Because children's nervous systems are still developing, their ability to process the pain varies with their age. So infants, for example, may have immature pain pathways, making them more sensitive to pain, in fact. Proper pain management in those pediatric patients ensures that their developing nervous systems are not negatively impacted by inadequately managed pain. And that's really important. And then just lack of education. So if your hospital provides any type of training on pain management, which obviously I believe all hospitals should, because it's such a crucial part of a pediatric patient's care, but that's just not a focus for many hospitals.
Right. Yeah. Let's do mine. 1, 2, right. Yeah. Let's do mama's. 1, 2, right. Good. Daddy's got your arms. Whoa, we don't like this. What's that? A 1, a 2, a right. Good. Yeah. All right. Is it a 1, a 2, a ready? Good. Yeah. Okay. 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 Bend it. It's a bend it. We need tissues. We need tissues. All right. Let's get your Band-Aids. Hold on to that. Good. We'll get your Band-Aids. Let's say, let's get this one on. You're going to take it right off. I know you guys. You take them right off. We'll take this and, good. All right, clean up, clean up. Everybody do this here. Clean up.
Okay, same thing. So what did we like about this? Tell me, how was this different from, other experiences? What did he do differently? Yeah, that's what everyone says. Whenever I play this video, they're like, where is this guy? Can I take him there? Exactly. Joyful distraction. Yep. So this is a video I also shared when I was giving pain management presentations to new residents who were coming into our hospital. I would always tell them, it's okay to do your job and be silly. If you think about it, a parent bringing their child into the outpatient setting, the hospital, I'm sure they're already anxious. They don't want to be there. The child doesn't want to be there. So I always say, do what you can to make it as light and easy as possible. He does a great job of first showing, first we're going to do mommy. I'm going to show you what it looks like on mommy. So it's so important as clinical staff members to always show what's going to happen, show them on their teddy bear, show them on their parent. Just seeing it happen to someone else helps them conceptualize that. They can understand a little bit better what's about to happen. He's just a great provider, very, very fun, very joyful, and that's important, especially for parents and their children. So working to minimize needle pain and fear. So there's physical, psychological, and pharmacological interventions. So physical interventions work through the pain gate control theory. So you have afferent and efferent pain signals. Physical stimulation alters the transmission of pain messages to the brain at the actual spinal level, and it interferes that transmission of pain by interfering with the pain impulses. So it stops it essentially. So I'll kind of go into this in one of my next slides, but you have afferent and efferent pain signals. So when you use something like fuzzy, it blocks that pain signal. It stops there and it says, oh, I'm okay. I don't need to be fearful. I don't feel that pain. Psychological is cognitive behavioral therapy. That's an example. It's a well-established and empirically supported treatment for procedural related pain in children and adolescents. Distraction is the most common type of cognitive behavioral method. And those are things, like, what do you do for distraction? Your light spinners, your toys, your games, everything like that. And then, of course, there's pharmacological interventions such as Painies, Sweeties, and Buzzy. Those are used to decrease pediatric distress from the more common procedures children experience, such as immunizations and venipuncture. And then, of course, there is comfort positioning that we all know and love. So back to chest, sideways lap sitting, chest to chest, swaddled or cradled for a little baby. I was going back and forth whether to do this or not. I kept it in here just to kind of talk about it. Yeah, I'll explain what it is, but I don't think we will do it today just because I don't know that it's as effective virtually over Zoom. So the experiment that I would do with new staff members when I'm giving any type of pain management presentation is an ice experiment. So the first time they hold an ice cube and they just drip it into a cup. And I tell them it has to be absolutely silent and you cannot talk. So I set a timer usually for about 30 seconds and the ice is dripping into a cup and they're all like, oh my gosh, what's going on? This isn't fun. And then after 30 seconds, they drop it. So I asked them, how was that? And they all say, well, that wasn't fun. I didn't like that. My hand is numb, it hurts. So then I say, okay, well, we're gonna do that again. But this time I have a light spinner and I have the game Spot It and you have to sing and we have to watch this video. So you provide all types of distraction and then you do it again. So almost always they all say, wow, oh my gosh, I never realized that, distraction can make such a big impact. I wasn't even thinking about the ice cube in my hand. I didn't even feel it. This is a great way to kind of get the skeptics, if you will, to believe in distraction. It makes them see firsthand just how important it is and how much it works. So on your own time, if you would like, do this experiment, do it with your friends, your relatives, your loved ones. It's a great one. Psychological intervention. So distraction, as we know, helps provide an alternate focus for a child during an uncomfortable or something that's anxiety-provoking procedure. So distraction is a form of positive coping. Offering distraction gives the child a sense of control, and during a time of stress, simply having the opportunity to choose how they want to cope with the procedure can be an empowering experience. So I always tell people, if you have the ability to give a child any type of choice, even if it is a little one, do you want us to look in your right arm? Do you want us to look in your left arm? Do you want to clean your arm? Things like that. It can really alter a child's perception of what's happening. It can give them that sense of control that they have lost since coming into the hospital, back to them. Because if you think about it, a child in the hospital does not get to make the choices that he typically would, back home. All the choices are being made for him. The procedures he has, the medication he has to take, the food he has, those choices are typically made for the child. So when there can be even little choices offered, that's so important. Clinical staff or vaccinators should avoid excessive reassurance and false suggestions. It won't hurt, as this promotes mistrust in children. We've all been there where we say, it's not going to hurt, you're going to be fine, you're going to be fine. But we have to really try to catch ourselves in those moments. It's not helpful for the child, it just builds mistrust. Psychological continued, so strategies that can impact the fear and anxiety tied into the experience of pain. A psychological intervention is chosen based on assessed fear and anxiety, past experiences with procedural, and then coping assessment. So what I'd usually say or ask the parent is, have you had this procedure before? What has helped in the past? Can we provide anything to make this as comfortable for your child as possible? Distraction is used to guide attention away from a painful stimulus. Distraction can lead to reduction in procedure times, actually, and the number of staff required, especially in children. And researchers hypothesize that children cannot attend to more than one significant stimulus at a time. So that's why distraction is so important. So if a child, for example, is getting a blood draw, but over here we're playing Spot It is a lot more enticing to a child. If you're actively engaging them in something, asking them a question, asking them to identify something, it's a lot more easy for them to remain distracted in what you are offering. Child life specialists, like all of us, are specially trained to distract and comfort patients during painful procedures. And then helping little babies 0 to 12 months cope with pain. I always love this 4S's calming strategy. Babies may benefit from using these strategies to manage their pain that is unique to their developmental needs. So the first one is swaddling. You know how to swaddle a little baby. This provides them that snug feeling of safety. When you're doing a procedure, you would just untuck that one limb that is needed for the procedure. It provides them with that sense of comfort. It's something that they're familiar with. Swaddling your infant with their hands brought up towards their face can promote self-soothing behaviors as well. So tucking their arms inward. And then shushing. It is important to match your shushing to the intensity of the baby's crying. So if they're crying louder, your shushing is louder. And to do so close to the ear. As the baby becomes more calm, you can decrease the intensity. And there should only be one person who's shushing to, not have that child be overstimulated. Swaying. So support your baby's head and gently, jiggle him like a little quiver back and forth. These movements should not be more than 1 to 2 inches side to side. So you should not be, flaying them around. This repetitive motion and gently patting or stroking the baby's head is calming for them. And then sucking on a pacifier. So pacifier, bottle, breast, encourage sucking. This lowers stress, blood pressure, and heart rate of babies and can trigger release of pain and can trigger the release of pain relieving chemicals in the brain. It's always important, though, to ask the parent or the caregiver. Some children do not like this. Some babies do not like this. And of course, we want to always assume that a parent knows their child best. So it's important to ask them what has worked for them. But if you're not familiar with the 4S's, there's a lot of YouTube videos, Google searches that you could do to learn more about it. So distraction, active distraction, as we know, allows a child to be involved in the experience while diverting their attention towards an activity or item. So examples can be playing with a favorite toy or stuffed animal, using something that's light up or interactive. We all love our, interactive wands, our glitter wands. You can read a book, you can sing a song, you can play music. I Spy books are great. Playing a game on the iPad is great. Stress balls, breathing exercises, and then just asking questions. Sometimes we forget we can just ask kids questions. What's your favorite character? What do you like to do? What sports do you like to play? Things like that. Just engaging in something else is helpful. And then this comes from the Journal of Pediatric Nursing. This is age-appropriate distraction suggestions. So for infants, parental presence, swaddling, pacifier. For toddlers, books with lights or sound, toys that light up or make music, button or switches that cause interesting effects, blowing bubbles, sensory toys, preschoolers, first I Spy books, sensory toys, blowing bubbles, musical instruments, school-age children, virtual reality, tablets, brain teasers, I Spy books, guided imagery. If you're not familiar with guided imagery, it is kind of taking their mind to a different place. There's a lot of great tutorials about guided imagery out there. So if you're interested in that, that's definitely something to look into. And then for adolescents, VR, trivia games, talking, texting, fidget items. Active distraction techniques are typically most effective versus passive distraction. So passive distraction is, look, I turned on the TV, watch the TV, doing something passively. Active distraction, on the other hand, is actively asking them to do something, to identify something. So if you're playing Spot It, can you tell me which one matches? Oh, can you answer this? Asking them to actively do something is a lot more effective. And this is one of my favorite charts. I had this when I worked in the hospital printed in just about every area. Language to avoid and language to use. So language to avoid is things like, you'll be fine. There's nothing to worry about. What you want to say instead is just something that distracts them. Hey, what'd you do in school today? What kind of sports do you like? Instead of negative focus, like this is going to hurt or this won't hurt, you'll be fine. It might feel like a pinch. So just giving sensory information is helpful. You're going to smell something funny. It's going to feel cold. It might feel like a little pinch. Instead of saying something like the nurse is going to take some blood, you want to really go through step by step what's going to happen. First, you're going to get your arm cleaned. You'll feel something cold and it might smell a little funny. And then you're going to get a tourniquet. It looks like this. Going through step by step, what's going to happen. You don't want to ever criticize a child for how they're coping. Every child copes differently, as we know. You don't want to say things like, you're acting like a baby. Instead, you could say, let's get your mind off of it. Tell me more about school today. And we don't want to say things like, it'll feel like this, the procedure will last this long. Instead, what I would typically recommend saying is, why don't you tell me how it feels? You can tell me afterwards what you thought so I can tell other kids. And then if they're asking about timing, you could say something like, the procedure will be shorter than this television show, or how long it takes to skip down the hall, something like that. You don't want to say this medicine will burn. You want to say, some children say that it has like a warm feeling. It feels a little tingly sometimes. And then don't give the child too much control. You of course want to give them control, but not too much. You don't want to always say, well, tell me when you're ready. I'll do it when you're ready. You can say things like, well, we have to be ready in 3 seconds. Do you want to count down with me? We can blow the feeling away. And then something that I catch myself, and I'm sure we all do, is saying, I'm sorry, it's going to be fine. You're being very brave. You're doing a great job. Thank you for being so still. Those are all great things to replace those type of comments. And then you don't want to say, don't cry. You want to say things like, that was hard. I'm really proud of you. And you don't want to say, it is over. It's not helpful. Pharmacological interventions. So Sweeties is sucrose, essentially sugar water. Sweeties works best if given 2 minutes before the procedure starts. It's for infants 0 to 6 months, but it can be used all the way up to 12 months. Out of plain curiosity, how many of you are familiar with Sweeties and or have it at your hospital? Can you type in the chat? When I have given this presentation to some healthcare facilities, I personally was so surprised by how many facilities were just like, I've never heard of that. What is that? So it's good to know that, that's not the norm. A lot of facilities do have this and are using that. So That's good to know. So for students who are not yet in the healthcare setting, Sweeties is a pain management technique that is utilized before a procedure. So how you would typically use it is, you would go get it from wherever it is, usually in med room, a drawer, something like that. You would dip the baby's pacifier in it 2 minutes before the procedure, and then you would put the pacifier in their mouth and rub their cheek. When the procedure starts, I usually dip it again right before we're about to start, and again rub their cheek. It's that analgesic effect that helps the child cope with the procedure. They are tasting it and it's like, wow, this is really good. Wow. So their brain produces dopamine, which helps with the pain of a procedure. Moving on to pain ease spray. I call pain ease spray my Elsa spray, like I'm sure many of you do. It's cold numbing spray. It's for children 4 and up, but not to be used for children with any type of cold sensitivity like sickle cell or poor circulation. Pain ease should be used in conjunction with an antiseptic and should be sprayed on right before a needle stick, as it is very fast acting. So something I did a lot of teaching on in my old job was to phlebotomists. When they would use pain ease, they would spray it and then they would walk away and go get their kit and go clean the arm. They wouldn't be ready to go. So I had to always remind them, hey, this is very fast acting. It's, a couple seconds. So when we spray it, I'm under the impression that you would be ready to go. If you're not, then we need to spray it again. Buzzy. So Buzzy is for children older than 12 months. Buzzy should be used 3 inches above where the needle stick is occurring. It should be held there throughout the whole procedure. So if you're, getting a needle stick, let's pretend here, you hold Buzzy here throughout the whole procedure. And like I was mentioning earlier, how Buzzy works is through the pain gate control theory. So you have afferent and efferent pain signals. When you place Buzzy here, those pain signals stop. They tell your brain, they send neuroreceptors that say, I'm okay, I'm fine, this is okay. It stops there. It does not keep going to where the needle stick is. So the pain message goes, it goes to Buzzy, it goes back up and says, oh, okay, that's fine. So Buzzy is a great tool. Some hospitals use it with the ice wings. It's great with the ice wings, but I've also seen hospitals use it without the ice wings. All right, with continued effort, undertreated pain and unfavorable outcomes can be avoided. So for all the students who are watching this and are going to watch this, take these tools and resources and everything you learned and everything you're going to learn on your own. It's so important to do your own research, to do, more knowledge, get more knowledge on your own, because, it's ethical. Children have the right to pain management, and as child life specialists, that's something that we very much should be focused on. So for any students, if you want to learn more about pain management, if you need more resources, I'm more than happy to provide those.
Canada is a world leader in children's pain research. But did you know it can take up to 17 years for research findings to be put into practice? That's a whole generation of children who miss out on the benefits of information we already know. What we know now is that 2 out of 3 children in hospital undergo painful procedures without any pain management at all. 75% of parents say they don't know how to manage their children's pain. Veterinarians get 5 times more training in pain than people doctors. And only a few Canadian health institutions have made a certified commitment to better pain management. This matters because pain that isn't treated well harms children's brains and bodies, is a struggle, and can be traumatic for families and health professionals, and costs the healthcare system time and money. Scientists have found many ways to manage pain, but most people don't know about these treatments. That's why at Solutions for Kids in Pain, or SKIP, we are working to improve children's pain management across Canada. We are a national knowledge mobilization network that is bringing together researchers, patients and caregivers, health professionals, 48 different health institutions, including all the children's hospitals in Canada, and over 100 partners from around the world. Our goal is to get knowledge about children's pain into the hands of people who need it faster. If you're a scientist or researcher, patient, caregiver, health professional, policymaker, or part of an organization or company with unique expertise or technology, you can help. In fact, anyone can. We all have the opportunity to be a champion for kids in pain. Visit kidsinpain.ca to find out how you can get involved.
So this is just one of the great resources that I suggest anyone who is interested in pain, children's pediatric pain, to connect with. They put out a lot of great resources. They do a lot of great research. So if pain is an interest point for you, I highly suggest you reach out. I know they're in Canada, but still they do a lot of great work. And something from this video that really stuck out to me and many others who have watched it is that veterinarians get more pain training than people doctors. To me, that's, it's sad, it's disheartening. When I've talked to residents, they say, yeah, we only had like one class on it, which is a little surprising because it's such a ethical implication. From an ethical standpoint, children have the right to appropriate pain relief, just like adults, any of us. It is a responsibility of, us healthcare providers to advocate for the best interests of pediatric patients and really ensure optimal pain management. That's part because, children who experience less pain are more likely to engage in their treatment plans, physical therapy, just experience more better quality of life during and even after their medical treatment. Danielle, I'm reading your question about, I'm curious if you have found any pain management techniques more effective for kids on the autism spectrum and or with sensory processing disorders. So a luxury we had at our facility was we had a rehab room that was just, like mats everywhere, and we had a Vecta cart. So we had a lot of great resources specifically for children who are on the spectrum or have another type of developmental disability. We always kept that in mind. I not so much used, Painies or Buzzy because that's, a sensory thing. Kids with autism typically would not like that, but providing like almost like fidget items, or I've had patients who really, could do a good job of focusing on that, but also some patients would bring like big headphones and they would play their music. It's always tricky. I'm not going to lie. It's always tricky to know exactly what's going to work for a specific patient, but especially when you're thinking about developmental implications. But there is more research coming out of, what to do, how to best handle patients who are experiencing sensory processing disorders or have a developmental disability. So I will stay on top of this. And if I do come across anything, I'll be sure to reach back out. Okay, now I am going to switch gears a little bit and I'm going to share a little bit about Starlight and how Starlight can help you provide these type of distraction items, pain management to you and your patients. So Starlight Children's Foundation, we are a national nonprofit that aims to deliver happiness to hospitalized children and their families. So for healthcare providers, for anyone who works at a hospital, an outpatient setting, a clinic, you can qualify to register for what's called a Starlight Hub account. And a Starlight Hub account is essentially an e-commerce platform that you can place free orders for items and resources and programs. So I'm going to just really quickly run through some of them, because if you're a student who is shortly going to be going into an internship or going to be starting a full-time role, part-time role as a child life specialist, I want you to be familiar with this because it's honestly something I wish I was familiar with when I started in my role. I was not familiar with Starlight. And when I finally did come across it, it was like, can't talk today. It was very life-changing because in the hospital, you don't get those resources. You don't have the amount of funding you would like to provide toys and books and games to patients. And that's where Starlight comes in. So for anyone who's at a healthcare facility, if you're a child life intern, child life specialist, social worker, doctor, anyone, you can register for a Starlight Hub account. So you go to starlight.org/hub and you would click sign up. But since I'm going to go through what it looks like, I'm going to click login. Once you log in, you are going to see the main page, and this is our homepage. It changes regularly what we feature, but this is what it'll look like when you log in. And I'm just going to go through a couple of our offerings to give you guys a better idea of, Starlight and what we can provide for you when you are in a role in a healthcare setting. Something that you can order off the Starlight Hub is what's called our Radio Flyer Hero Wagon. It's a compactable wagon. It folds really easily, so it's super easy for storage. It was made specifically for the hospital setting in conjunction with Starlight and Radio Flyer. You can order up to 20 wagons per year. And again, all these items are completely free. Something that's a little bit different is our gaming stations. So our gaming stations are what's called wish list items. So you would place it on your hospital's wish list. So our Nintendo Switch gaming station, it comes on wheels and it comes with about 27 or so games loaded on there. You can wheel it from room to room. It's easily wipeable, so you can sanitize it. This you place on your wish list, and then Starlight will then distribute it based on donor funding. So when we get fundraisers and corporate donors who donate money, we'll look at our wish list and say, okay, who's had it on their list the longest? Demographic data, things like that, and then we will distribute it that way. And that's the same thing for our handheld Nintendo Switch. So handheld is just, smaller. It comes with games loaded on there, but same thing. It's portable. You can bring it from room to room, and it's easily wipeable. And then our Starlight deliveries are our toys and our games, magazines, things like that that you can order. And these ship directly to you from our warehouse in Omaha. They typically take about 2 or so weeks to get to you. We have our Extraordinary Kids coloring book, who was actually designed by an occupational therapist named Lynn. She's a pediatric occupational therapist, and it's an inclusive coloring book. And we are super grateful to partner with her on this. It was a project that we were all really excited about. We have a lot of Rebel Girls right now, so they're empowerment journals for early teenagers or school age, like 7 to 12. It has original artwork, and these are all designed by female artists. It helps girls think about critical thinking skills. And then we have a lot of Legos. So if you, like many other child life specialists, like to distribute Legos, this is the place for you. We have Lego Dots, Lego City Stunt Bikes, a whole bunch of different ones. Some of these do have quantity limits. So, okay, so some of them don't have quantity limits. Like, some of these just you can order as many as you want. So what I suggest to child life specialists is if you have an event coming up, or you just have the space for it, you're lucky and you have the space, order as many as you would want just to have and give out. Items in Spanish, we do have, not on here. We do have a My Starlight activity book that's in Spanish. If you email me, I can find out when we will have more in stock. We do typically offer something in Spanish, but right now it just must have went out of stock very recently. More Rebel Girls, and then our Starlight gowns. We have a hospital wear program where we distribute gowns free of charge. They're in a variety of sizes, extra small through extra large. Right now we are offering our Starlight Star Wars gowns. And then our Disney program delivery. So one of our biggest corporate partners is Disney. They provide their gift in kind, and then we just serve as a distributor for them. So for facilities who don't have it, you can get an Apple TV with Disney Movie Moment enrollment, which is something that's super fun because when something Disney streams in theaters, you can actually stream it at your facility a couple weeks later. So like the new Ariel movie and other Disney movies that have recently played are now available on Disney Movie Moments. We have costumes, adaptive costumes, which is great for Halloween, which is very soon, surprisingly. But if you order it now, it'll be there in 2 to 3 weeks. Disney DVDs, a DVD bundle, and then a Disney subscription access code. So Disney Plus is available for your facility. It's good on up to 4 devices. So like big TV and then 3 iPads. And then this is super fun. If your facility has the space for it, it's like almost like a cardboard material. It's a pop-up finger puppet theater, and it comes with little finger puppets. We have one in my old hospital's playroom, and it's a big hit. It comes with 2 per box. And then this is brand new, our National Geographic themed Disney delivery. It comes with a variety of National Geographic stuffed animals, toys, experiments, things like that. And then finally, our digital resources. So these are things that you can download right away. So if you watch the movie Soul and you want an activity guide to go with it, you can just click it right here and it'll download right away. So everything here is fully downloadable. You can then print it, use it on an iPad, however you want. And we do have the book Blood Soup. So if you work with sickle cell patients, what I did is I just printed these and had them readily available. And we have, different journal prompts, how to write your story, things like that. So there's a wide variety of resources. And then last but not least, I'm going to talk about VR. So 2 ways to get VR. Our first way I'm going to talk about is through what's called our Starlight Families program. So Starlight Families was created to bridge the gap for patients when they go home. So Starlight recognized that, after the hospital, there's not many resources provided to families. So we've created a program to provide free resources like newsletters, gift cards on your birthday, toys, special experiences. And then the most exciting one is a VR headset. Any clinical staff member can refer patients to receive a free VR headset through Starlight, so long as they have a serious medical condition. Families must be referred by a hospital staff member. They cannot have a contradiction to VR, including a history of seizure disorder, nausea, or vertigo. If you are interested in referring a patient to receive a VR headset, they first have to be signed up to be a Starlight family. And then anyone, a child life specialist, a nurse, a social worker, a doctor, anyone can refer them to then get their headset. We will then reach out to the parent, and the parent will fill out a form to get the headset, and then it will be shipped to them in about 2 to 3 weeks. That is how that works. And then our brand new headset for hospitals, which is a different program, this is how you would order it, is on our Starlight Hub, but it's a wish list item just like our gaming system. So it's our new Penumbra headset, same thing. It's a wish list item, so that means you will not get it right away. It'll be put on a wish list. And when we start getting fundraisers and donors for this, we will then start distributing it. But it's a really cool headset. It comes with a lot of new features. It has a lot of great games on there, voice command options. And the nice thing is it can be used with or without Wi-Fi. So especially for doing procedures, if you're doing any type of like dressing change or things like that, this has been proven to be really helpful. We did research before we decided on a VR headset, and this was the one that we really thought made the most sense. So we're super excited about that. If you don't want to wait for something that's on a wish list, like a wish list item like VR or Nintendo Switch on wheels or the handheld one, you could always outright buy it if you're interested in buying it. I can also provide more information on that if you email me. With that, I think I am just about done.
Victoria, I think you've done a fantastic job of really talking about different ways to help address like pain management. I mean, as a mom myself, and taking my young infant or toddler now to the hospital to get those shots, I'm like, ooh, I could have taken your presentation and taken some of
That's I've heard that.
So I think everything was very useful, very helpful for me, at least having a young child. Hopefully the audience here found some of these strategies helpful. If you're a certified child life specialist, you can walk away with some strategies and skills for, working with your patients. Otherwise, if you are interested in a PDU, please type in your name and your email address. And within the next few weeks, we will be sure to send out a certificate from UCSB with the PDU and the name of this presentation.
And I just shared my email in the chat. If anyone is interested in pediatric pain management, I have a lot of great resources that I would just love to share. From my time at La Arvida being the chair of the Pediatric Pain Committee, I have come across a lot of research and a lot of great things that you can use in your own practice. I'm not a full-time child life specialist right now. I work full-time for Starlight. So if these are resources that I can pass along to you, that would be very great. It would be helpful for you.
In one of our child life courses, and your instructor said you will get extra credit, please also put that in the chat so I can message your instructor.